Go.
How many of you know what depression is? How many of you know how many people are affected by depression? How many of you are familiar with any parts of what depression actually is? According to Gulabor 2015 from LiveScience.com, depression affects an estimated 16 million adults, or about 7% of the adult population, have had at least one major depressive episode or experienced some time of depressive symptoms in the past year. In my studies, I have learned a lot about what depression really is, the cause of depression, the symptoms, the treatment, and what others can do to help. To become familiar with the topic and the severity of depression, I will cover 5 topics throughout my paper. These 5 topics will include what is depression, the symptoms of depression, the causes of depression, the treatment for depression, and what we can do to help a loved one suffering with depression. In order to understand how depression affects an individual, the definition of depression will be presented. According to Gulabor 2015 from LiveScience.com, depression or major depressive disorder is a mental health condition marked by an extended sense of sadness and despair that affects how a person thinks and feels and functions. Depression is a mental health condition. The condition may interfere with a person's daily life and thinking patterns. Depression is not the same as sadness or grief. Certain medical conditions may also trigger depression. This includes an underactive thyroid gland, cancer, prolonged pain, and other significant illnesses. Hormonally induced depression can arise after childbirth or at menopause. These are some of the conditions on how depression works. The condition of depression is oftentimes found in women 2 times as more in men. Women between 40 and 59 have the highest rates of depression. There are many symptoms that can accompany depression. These symptoms include irritability, agitation, restlessness, inability to focus, insomnia, excessive sleeping, change in appetite, unexplained body aches or headaches, feeling hopeless, feeling worthless, social situations, or thoughts of suicide. Any of these activities can trigger depression. People with depression will most likely feel a deep feeling of sadness. They will feel a lack of interest in pleasurable activities. Now that we know the definition and condition of depression and the symptoms, let's take a look into some of the causes of depression and the types of depression. Depression is divided into many subsets. According to Fawcett 2014 from the Huffington Post, the most common type of depression are stated in the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, also known as the DSM-5. The most commonly diagnosed form of depression is major depressive disorder. The symptoms that accompany major depressive disorder are depressed mood, loss of interest, weight loss, and no energy for weeks at a time. Major depressive disorder affects approximately 6.7% of the U.S. population of individuals over age 18. According to the National Institute of Mental Health, women are 70% more likely to be diagnosed with major depressive disorder than men. Some women get diagnosed with postpartum depression after giving birth to a child. This can be caused by lack of sleep, family susceptibility, chemical changes in the brain, and estrogen and progesterone levels dropping from giving birth. Another type of depression is persistent depressive disorder. Another name for this is dysthymia. This is chronic depression that can last from 2 to 5 years. The individual will lose interest in social activity, feeling hopeless, feeling worthless, and can affect 1 to 3% of the population. According to Fawcett 2014, the DSM-5 has different subtypes that have their own unique features. For example, depression has mixed features. A person can feel sadness and mania at the same time. They can also experience extreme highs. The depressed person will lose interest in all activities. Depression can also have psychotic features. This would cause delusions or hallucinations. There can be many causes of depression. Depression can also be genetic. Researchers believe that this is to be true with people with manic depression, also known as bipolar disorder. There is a genetic link for depression. According to Holmes 2016 from AboutHealth.com, this shows that those who have bipolar disorder can pass that on to other family members. Major depression is also in the genetic link category. It can develop whether or not there is a genetic link. This causes depression in women after a common woman gives birth to a child. Depression in men can affect their physical health and show that men can suffer from coronary heart disease. Men will feel irritable or angry. Men will be less willing to admit that they are depressed than women. Depression in the elderly is caused by aging or side effects of medication. Most elderly individuals do not feel depressed. The causes of depression cause sadness, feeling helpless, feeling weak, feeling anger, irritable, emotional breakdowns, and stress. The victims of depression will act disengaged and sad. They will feel angry at times, sad at times, and hopeless. We will now begin to explore the types of treatments for depression along with ways to help to care for our loved ones suffering from depression. There are steps to take in order to treat the many types of depression. The first step in treating depression is to make an appointment at the doctor's office and getting a physical examination to rule out any other possible outcomes. The next step is to receive proper treatment, to contact a diagnostic evaluation for depression. Seeing a mental health professional would be the best route to take. The next step would be receiving an evaluation, then proceeding with the type of depression that the person is suffering from, along with the treatments available to them. A person suffering from depression could be put on medication or treated using psychotherapy. Other types of treatment are electroconvulsive therapy, in which electric currents are passed through the brain to change the brain chemistry. Psychotherapy is treating a mental health problem by talking with a psychiatrist, psychologist, or other mental health providers. If the medicine is one of the treatment routes, an individual can take an antidepressant along with anti-anxiety medications. Finally, to help a loved one suffering from depression, these steps would be taken. According to the book by Schimmelpfennig 2016, a person needs to educate himself or herself on what type of depression their loved one has, along with the answers to the common questions. The second step is to put yourself in their shoes. Try and learn what depression would feel like, the misconceptions, and how depression is dealt with. The third step is to take care of you. Feelings of depression can be contagious. Periodically take a step back and recharge yourself. The fourth step is let your emotions out. Feel angry, feel frustrated, or upset, and join a support group. The fifth step is to be there for your loved one and on full capacity. Support your loved ones and let them spill their hearts out. The sixth step is to remember that a person's behavior is not an indication of the person that they actually are. The seventh step is to make sure the loved one is taking their medication and attending their therapy sessions. This is crucial in the treatment of depression. The final step is to love your loved one unconditionally and let them cope and feel better. Find what works best for them and show them the happy things in life. Show them suicide resources in order for them to prevent suicide and cope with the illness. I hope that you are all very informed about depression. I hope that you all learn new things and can go out in the world and help people we love with deal with depression. I hope you are more educated on this topic and understand what depression is, what it causes, the symptoms, the treatment steps, and what we can do to help. Use this information to help keep others educated on depression. Thank you for listening.